welcome to Balanced Health. I'm Shirley Rose, and this is Joe Costello. The United States is one of the most scientifically advanced countries in the world, and yet the chance of a woman having breast cancer sometime during her lifetime is about 1 in 8. In fact, women in the U.S. have one of the highest rates of breast cancer in the world. Breast cancer rates second as a cause of death for women, and over 49,000 breast cancer deaths are expected this year alone. Chemotherapy, radiation, and surgery are common treatments. But are there alternative treatments that are less invasive and less dangerous? Today, our special guest is Dr. Francisco Contreras, the director, president, and chairman of Oasis of Hope Hospital, and he's here to discuss alternative treatments. Dr. Contreras is a distinguished oncologist and surgeon and oversees the treatment of some 800 cancer patients annually. And Dr. Contreras, you're all of those things, plus you're an old and dear friend, and it is such a pleasure to have you with us
Shirley,
today.
it is my pleasure and honor to be here with both of you. Very good friends, and I have fond memories of both of you.
I'm just sorry that my husband's out of town and didn't get to say hello.
Didn't get to say hello.
But you have done such an amazing work over the years with cancer patients that really had no hope anywhere else. And we're just so pleased that you've come through Chicago to be with us today. I think we all know what breast cancer is, but maybe you could start off by just talking about the different types and how the types differ, and just kind of a little teaching on breast cancer here.
Yes, there are basically two types. The ones that begin within the ducts of the breast that bring the milk into to the outside, and the other one is the one that begins within the cells of the breast itself. Those are the two big families. The most common one is ductal cell carcinoma.
Really?
And one of the reasons why it's so much more common in this time and age is because women tend to not breastfeed their children. And so many of the toxins will stay in the ducts and will not be carried out through the milk.
That's a very good argument for why women should breastfeed their babies.
Yes.
But I had mine in the 70s, and it was just taboo. It was not done, and so it's to our disadvantage. But that's actually.
Speaking of arguing, would your because we know you do conventional treatment. You also do some alternative treatments. Would the hardcore conventionalists agree with that notion that breastfeeding has anything to do with the incidence of breast cancer?
Well, it's published by most prestigious magazines in America. So whether they like to acknowledge it or not, it is a fact.
It is a fact, and in fact, it's listed with some of the high-risk factors.
Correct.
Is the fact that you did not breastfeed. So
Yes.
yeah, everybody acknowledges.
Everybody
I think
acknowledges
at
So
this point.
hopefully that information gets to young or would-be
Yes.
mothers.
Yes.
I mean,
Yeah, because we're so subject to
Yes.
trends. Is it in vogue to breastfeed this year? I mean, we just need to get beyond that and do what's healthy.
there's no marketing budget for the breastfeeding foundation. I mean, Infamil and all those people, they have some big money behind them.
Yes. This is just a matter of design.
Yes,
Right.
it is.
Scott.
God made us that
Well, we
way.
talk about
Hello?
that all the time on this
Yeah.
show.
Okay, so I interrupted you about that, but so that's the two basic types,
Those are the two basic
most
types.
and the most common
The
is
most common
the
is
one.
intraductal
Wow.
breast cancer, and it tends to be more aggressive also than the other one, meaning that it tends to metastasize easier and go to other places and end with the life of a patient much sooner than the lobular carcinoma of the breast.
So it's usually terminal then, or more often terminal than the other.
I hate to use the word terminal because we are all terminal.
Right.
And
many advances have been made to treat it.
Exactly.
So, yeah.
And so, one of the myths out there is that you are diagnosed with cancer, you're dead.
I know.
It's not true.
It's not true
It's not
anymore.
true.
Praise
we have
God.
patients
it's
that
not
were
true.
told, they were going to live 3 months, and 20 years later, they're still walking and enjoying life.
Well, we're going to ask you about some of those success stories in a minute, but what are the different stages of breast cancer?
We've staged them usually in 4 stages. One being the least amount of tumor mass in your body, and that the tumor is localized to the breast, and it's usually curable with surgery. And then it goes through stage 4, where it then has metastasized to areas outside of the breast. And obviously, the higher the stage, the more complicated and the worse the prognosis is.
Which is why it's so important to find it early. And with that idea that it's very important to find the cancer early, let's talk about self-examination and some of the maybe
Yes.
preventative or ways to detect it early. What are some of those?
One of the things that I want to touch on is because there's a confusion on prevention and early detection. They're two completely different things.
They are different, sure.
And people, you don't wake up in the morning and say, I'm going to prevent cancer of the breast, I'm going to do a mammography. You're not preventing anything.
No.
If you find it, even if it's in the earliest stage, it's already not
You didn't
prevented.
prevent it, right.
So prevention is to me a lot more important. But yes, early detection makes a big difference. And there's this tendency on, especially American doctors, more than in many other parts of the world, to recommend as a preventative action to take mammograms, which I am very, very opposed to, because every time you take a mammogram, you increase your chances of developing cancer by 2%.
Oh,
Why?
you're kidding.
No,
Because of the radiation.
because of the radiation.
Wow.
So if you take 2 a year, in
Wow.
10 years,
You've
you
doubled
already,
your-
yeah,
goodness.
you already increase it by 40%. And in fact, if you look at the line of the increase and the explosion of cancer of the breast, it goes parallel to the beginning of screening mammography.
So you
Let's
think
pick back
that
up on that, Shirley, when we
Yes.
come back, because I think right
That's
now our
huge.
viewers are going, wait a minute,
Yeah,
that's not what my doctor said.
But they are learning more and more all the time.
Yes.
And really, like you were saying, does everybody know this? I think it's getting to be common knowledge that maybe so many of them are not really required. Well, we're having a great discussion here, but it is time to take a quick break. And when we return, we'll discuss the different types of conventional and alternative treatments for breast cancer with Dr. Contreras. So stay tuned. We'll be right back.